The fight against the new Omicron variant in Senegal starts here at a health center in downtown Dakar, where doses of the COVID-19 vaccines are available.
It's not because we have a vaccine that we're immune. We need to keep protective measures and protect those around us. It's not over.
At a two-day peace and security forum held in Dakar on Monday, South Africa's President Cyril Ramaphosa accused rich countries of creating health apartheid.
I have personally really been disappointed in the approach that the rich countries have taken on the issue of vaccines. Firstly, they hoarded vaccines. They ordered more vaccines than their populations required. And when we wanted vaccines, they just kept, giving us the crumbs from their table. And the greed that they demonstrated is something that is quite disappointing indeed, particularly when they say they are our partners.
The pandemic overshadowed the 7th Peace and Security Forum held here, which welcomed heads of state, intelligence officers, and military chiefs. Usually, discussions at the forum revolves around greater military cooperation between Western nations and African countries. But with Western countries breaking their promise to supply vaccines and their unwillingness to waive patterns to allow people here to make their own, trust is eroding, with some nations looking at new partnerships. To help the fight against COVID in Africa, China announced it's sending 1 billion doses of vaccines. On the fight against armed groups in the Sahel region, Niger's president admitted that al-Qaeda affiliates are in some places better equipped than the security forces of some countries in West Africa. Following increased attacks, Mali is seeking help from the Russian mercenaries working for Wagner, the private military company.
That's why countries like Mali, we have decided to go more and more for diversification of our partnerships. We can work with China, we can work with Russia.
Also at the forum, delegates from Western nations reiterated their goodwill and intentions, but countries such as South Africa and Senegal say that's not good enough. Vaccines made in Africa for Africans is what they want. Almost 250,000 Africans are reported to have died of the virus so far. The message here is those deaths were preventable if only victims had access to vaccines. Nicholas Haque, Al Jazeera, Dakar.